Have you noticed there's wrinkling around your mouth, maybe around your lips, your chin, but nowhere else on your face? You have smooth cheeks, a few little lines around the eyes, but that lower face, darn. Every time you talk or eat, which is exactly what you do when you're around other people or at social events, those pesky lines appear and you're attuned to thinking about them, and so it changes how you move and articulate your words and how you're positioned around people. Oftentimes, they make people look much older than they really are because of all the changes that occur around the mouth. They can just look older. So this is exactly what I see in my clinic every day. Let's take this face. The first thing I'm going to do, I'm going to cover the lower face. Now, how old do you think this person is? Okay, you got it. Now I'm going to cover the upper face. Now, how old do you think this person is? You see the incongruencies, and you see what injectors and aesthetic surgeons are faced with every day. The lower face is complex. This patient is going to want the lower face to look good, narrow, not square, and rejuvenated. Why is this often happening? Because a lot of people get fillers and toxins in their upper face and they neglect the lower. Today I'm going to share with you why this happens and give you 3 great solutions, each taking into consideration the perfect angle. And it's really important. One of these is all natural. People are often scared to do a single thing about it around the mouth because it is the #1 area that filler is a telltale sign when you get something done, along with those big lips, of course. But we're really talking about the area around the lips. You see, the issue with treating the lower lines is it can create a square look, and a square look is more towards a masculine look, but it's also the done or filled look, because as we age, the lines, the folds, the sag create that squaring, and especially if the jawline isn't squared, it can look more masculine. Stay tuned until the end of this video because I'm also going to share my #1 topical skincare product for those who might not want to have procedures done. And again, prevention is all key, and you can prevent things, especially like bone loss. So watch my videos on vitamin supplements and my #1 supplement that's missing, that's creating wrinkles. Like, subscribe, and share these videos with your friend if you find them useful and helpful in your aesthetic journey. So why do they occur? Well, there's bone loss, there's skin loss, there's collagen, hyaluronic acid, and muscle support that's gone. And there's something we call myomodulation, even more complex. Not everyone believes in it. The point of telling you this is it's so complex because it's a movement area. And that's why it's hard to treat. But if people only do cheeks and only get toxin in the forehead, there's a real incongruency from the upper face looking young and the lower face looking older. My #3 solution is what I call VFR, or Viora's fractional radio frequency. I don't use RF microneedling typically in the lower face at the chin area. I know that's my top treatment of 2021, but I use that more where I'm willing to get rid of fat. At the lateral pre-jowl here, where I want to preserve the fat and only tighten the skin, I use fractionated RF because it preserves the fat, it makes things look smooth, and maintaining that fat is useful. Fat in the right place is very useful. So where do we want to get rid of fat? Typically it is the jawline and the edge of the mouth, and radio frequency can certainly do it. A lot of people on this channel ask me, high frequency ultrasound, I had RF, I got rid of my fat. Yes, it can, because there are procedures built to get rid of fat that use those technologies. Fractional RF uses electrical energy. It's not a laser, so all skin types can be treated. There's minimal downtime. It's less sensitive to pre-sun exposure because there's no laser that targets the pigment. It's more electrical energy. Minimal downtime and a very reasonable recovery. People are so sensitive to recovery these days, even with chemical peels. If they peel, they're a little upset. But that's what a peel is. So something like this, there's much less recovery, usually a day or 2. So contrast that with RF microneedling, where needles actually go into the skin I use a Lutronic device like this, and you'll see the needles go actually into the skin, into the different layers. You can see it here. We use 3 different layers typically. I put the energy down. I can use different depths, pulse duration, and amount of energy so I can target fat or skin. But the VFR does not have needles that go into the skin as you saw prior. The energy stays on the outside, but it does give a little erythema or redness to the dermis, but you do get that tightening in the deep layers. So a big distinction. Number 2 choice here is dermal filler. It's best for projection because remember, filler does 3 things. It volumizes, and we do want a little volume here. It hydrates, a little bit of hydration would be good, and it contours. Most people need some contour around the chin. It's readily available and it's fairly quick procedure, so a lot of people can get it done and have access, and people like instant and quick. They like 2 of those things, and there's minimal discomfort. It's not the best procedure, however, if there's excessive loose skin. It's best in those younger, say under the age of 50, where the skin is still good and they can use projection and contour and it would look natural. My number 1 choice is biostimulators, and I use Plasma Sculpt, which is PLLA, Sculptra, poly-L-lactic acid, mixed with your own body's product, which is platelet-rich fibrin. People therefore have the choice. If you want all natural, you just do PRF. If you want to add a little bit of PLLA, you can dilute it in, and it looks really good. The reason is it adds a level of safety against nodules, lumps, bumps, and getting too much volume produced. The result is gradual, so no one really knows, and people like that. People with loose skin, we'll just say 50 and above, they don't like anyone to know they've had treatments. There's still that stigma from when they were 30 or 20. And so this is gradual, it's long lasting, and there's very little risk of bruising and side effects. So people like that when it's done well. This is not the best if there's major contouring needed. There's no high G prime. This goes in as a water. It absorbs, you build collagen over time, but filler can easily be added afterwards. Now, you do all this, or you don't want any of that. You want minimal results. You have to be mentally ready for minimal results if you don't want injections. The number 1 skincare in this area is a retinoic acid with a small amount of hydroquinone. A lot of those you're going to find have a little bit of steroid on that, because if people are using it all the time, I don't like chronic steroids on the skin, even though it is a sprinkling of a dose. The reason is, and you have to be careful, you don't want too much retinoic acid or retin-A. And if you can't tolerate it, you go to a retinol. Better yet, retinol acetate is one of my favorites if you can't take the full retinoic. There are 3 different retinols that I personally use and like. If you want to know exactly which ones they are, go to the bottom of this video, click on Show More, and in the description, there'll be a link to those exact 3. You can go and look at them, and those might be worth considering for yourself. But that's been shown to thicken the dermis, to make the skin improved. But if you do use it too much and you get inflammation, everyone's dose is different. So if you're getting inflammation, redness, or irritation on the skin, you come down in your dose because it will create aging. And thickening the dermis is what's needed here. Now, skincare is not going to create volume, so it's impossible to get rid of all the vertical lip lines or everything you need down here, but it works great with the injections, and it's really best used alone only for those who are unwilling to get injections. But hey, PRF is an injection, it's your own body's product, it's 100% natural, so I wouldn't see why people wouldn't do that. Now, lower face aging, I have videos on vertical lip lines. I put a video right up here on vertical lip lines or barcode lips. You can watch that. Tell me, are you seeing signs of lower facial aging? It's very common that the lower face is incongruent with the upper face. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.